Welcome to AHO Radio. I'm Jerry Bowles, the National Sales Director here at America's Health Options. I am again honored to host this segment of AHO Radio. AHO Radio is aired as the agent service and training platform for America's Health Options insurance plan. Today, you're in for a treat. We have a very powerful visionary and fellow agent, Mr. Richard Spalter. He's the RVP of the Michigan area. And we have our very special guest, Mr. Clive Fowler. Clive is the CEO and managing partner of America's Health Options Insurance Plan. Clive not only is reshaping the future of health insurance, but insurance in general in the United States today. Without further delay, I want to bring on Mr. Fowler and let him, because guys, we've got a lot to give you today, and it's all very good. Mr. Fowler, are you there, sir?
Yes, I am, Jerry. Thank you so much for hosting this, and thank you, Richard, joining us here. We've got a lot of things that we want to explain to you guys today. We're going to jump right in. Today, we're going to talk about agents' commissions being made very, very simple. The platform behind America's Health Options is being able to protect the health, the life, and the wealth of their clients in 3 easy steps. And we're going to take a few brief minutes to go through the product itself. We're going to talk about how the commissions work. We're going to show you how to sell the program. And we're going to show you a very unique opportunity to get in on an exclusive America's Health Options quoting system that allows you to quote the whole platform alongside the ACA. That's correct. You heard it correctly. We're going to be able to pull it and do an actual comparison side by side. Let's jump right in, guys. What you're looking at right now is our management team. And this is a combined of a minimum of 130 plus years worth of experience is what you're looking at on this screen right here in all aspects of the financial services business from each side of it. So we're going to roll right through here. Let's take a real quick look at the product. The America's Health Options platform was designed to save a client 30 to 60% versus a comparable ACA platform product. Whether that's Blue Cross, Aetna, Cigna, United, doesn't matter. This was the focus, and we're able to do that. Our platform stands with a minimum $5 million lifetime benefit per individual that's in our plan. It comes with the ability to see any doctor, anytime, anywhere in the U.S., see specialists without referrals. It sits on a nationwide PPO network that is multi-plan and PHCS. The plan comes with a zero deductible program. Now, we have 2 plan versions of this. We have a deductible version and a zero deductible version. Today, we're going to talk about the zero deductible version, which is known as Health Choice Select. It comes with hospitalization coverage, emergency room benefits, outpatient benefits, which includes your doctor's visits, but it also comes with a $50,000 lump sum critical illness benefit based on diagnosis only. It comes with an accident program built into this platform that comes with $2,000 a month in disability options for up to 24 months, not to exceed 60% of someone's monthly income. Now, that's pretty decent to understand that an accident portion of your health plan allows you to be able to get disability components built in if in case you tripped over the family pet. Comes with prescription drugs. That's a true formulary prescription drug plan, not a discount card, but a true formulary prescription drug plan based on generics and brand name. Dental is also available in here. It comes with a full teledoc platform, and that allows you 24-hour access to your doctor or a medical personnel via video or telephonically. It comes with a very unique concierge service that is individualized for each client, which allows them help with medical services such as bill payment and surgery cost negotiations, plus several other things included inside that platform. It comes with a minimum essential coverage plan, which makes the whole platform ACA compliant so that the client never has to worry about paying the taxes, but it also includes all your annuals and wellness visits inside of that platform at no additional cost to you within network. But here's the real sweet thing about the AHO Flex platform. This platform comes with what we call a return of premium feature. Now, this is unique because every client's complaint has always been, I spent all this money on health insurance and I get nothing back at the end of the time, and I didn't even need to use it. Now, you as an advisor has an opportunity to discuss with your client an option where they can get back premiums coming back to them at age 65 so that they did not lose any money. And it also comes with an additional catastrophic benefit included for heart attack, stroke, cancer, things of that nature. Let's jump right in and show you how the product compares against a major medical. We're going to take a look at Blue Cross over here. It's a Blue Cross Silver HMO plan with a family deductible of $11,000. If you look at our Health Choice Select plan, we have a zero deductible option right here. Then if you notice on that Blue Cross plan, it's $1,950 a month is what the client is paying. Now they're really getting clobbered over there between the monthly plus the deductible plus the maximum out-of-pocket expense. If you look at our Health Choice Select program, what we have here, we came in at $1,277. And what was included in that $1,277 versus $1,950? They got $1 million coverage of Health Choice Select per individual. So in this case, with a family of 4, that is $4 million worth of potential benefit inside that household. But remember, all of our plans are a $5 million lifetime benefit. So we're not looking at just $4 million annually. We're looking at $20 million worth of lifetime benefit to that household. It comes with the minimum essential coverage plan, critical illness on the parents and the children. It comes with accident with 12 months worth of disability in this example, came with dental of up to $2,000 per individual in that house, and or unique AHO return of premium feature, all of that for the $1,267. What was the savings? $672 a month for that family. Immediate savings. That's a total of $8,000 annually. What we're looking at is the cost of a used car. You just can't get any better than this. So what happens between a major medical insured patient versus a fixed benefit insured patient? Take a look at this real quick, guys. We've got here an MRI. This was done in Flint, Michigan with Aetna. With Aetna, we were looking at $445 for that MRI on the foot. It was $379 for a self-pay rate. Here we see a tonsillectomy. This was done in Mesa, Arizona, and this was Blue Cross of Arizona. It was $5,400 with them. It was $2,800 at a self-pay rate. It was $1,100 for an MRI on the knee in Boulder, Colorado, and versus $600 for a self-pay rate. Clearly, there's a distinct difference in savings for someone who chooses to use a cash reimbursement program like our Health Choice Select platform. Let's talk about the money to you as an advisor. For you providing such a great product to your clients, what's in it for you? Here's what's in it for you. If you were to sell a Blue Cross plan right now, and here's another example, family of 4 again, with the same $1,950 in monthly premium, what is your income? Your commission is $125 is your commission. Now, you know, it's money. But let's think about the amount of work you put into that. You're actually being paid $15 PMPM is what you're getting it for, a grand total times 12 months for $720 of annualized premium commissions monies coming to you. If you were to look at our plan, and if you sold them a $665 Health Choice Select platform and $1 million coverage with a 20% commission rate on there, now you're looking at $1,500, almost $1,600 in annualized commissions coming to you. But because our programs are what we call stacked option plans, which allows you as an advisor and the client to be able to create an a la carte program that specifically fits their needs as opposed to a cookie cutter Blue Cross plan, here's what happens. You add the minimum essential coverage in there. You add in the critical illness in there. You put your accident in there with the disability. You put the dental, and you put or return of life premium feature inside there. And look at the commission stack: 20%, $4, 65%, 45%, 35%, and 60%. What is your commission? Your commission for a $1,260 premium comes out to be $4,398. That is your money that you earned. I don't know what to tell you, but that's a significant difference between $720. Now, what happens if you were to duplicate this same sale, but you did it 4 times for the month? Let's see what happens. If you sold 4 ACA plans right now at a $1,200 a month premium, which makes a total of $4,800 for the month, at an average commission rate of $15, with the average agent commission coming at $120, and they kept it for 6 months, you made your $720. But if you sold 4 Health Choice Select plans at a $665 premium instead of $1,200 premium, almost 50%, okay, just a little hair over, and coming in at $2,660 versus $4,800 a month for a grand total of monthly premium, but you did that at 20%. Now you're getting $532 versus $120 times 12 months. You're looking at $6,300 in annualized commissions coming to you. That is a beautiful thing. But what happens if you decided to actually build your business off of stacked option applications as opposed to building your business off of cash needed? We're going to show you how today you can change the landscape of your business by building it based off of applications rather than building it off of cash needed. Here's how you solve your income problem forever. If we take 4 stacked options, and we're just going to start with the Health Choice Select, which is the hospitalization portion. And if you only did 4 of these for the year, 4 for the year, you're looking at a $6,300 annual income in commissions coming to you. If you did 12, it generates $19,000. You did 24, it's 38. 48 stacked options, looking at 76 just on the Health Choice Select. And if you did 96 Health Choice Selects for the year, you would have received $153,000 in income. But because, again, the beauty of the AHO system is that we're using stacked options, take a look at what happens when you add the rest of the suite. We put the MEC in there, 4 MECs. You put in 4 critical illnesses. You put in 4 accident with disability. You built 4 dental plans. And then you built 4 AHO Flex Term Retainer Premium Feature Life products inside there for your client. What did you just do on your monthly income? If you only did 4 for the year, you've just generated $17,000 worth of income for yourself for the year, or a grand total of $1,466 a month. If you did 12 of those, now you've generated $52,000 of annual income, or a total of $4,300 a month. If you did 24, you just crossed 6 figures. You did $105,000 worth of income at 24 stacked option suites. Everything you see here in this line, okay? If you did that, you've just produced $105,000 worth of income. If you multiply that off of a $1,260 monthly premium per client, you've just generated $8,700 a month in income for yourself. If you did 48, you've crossed $200,000 and just generated for yourself a $17,000 monthly income. And here's the granddaddy of them all. If you did 96 stacked options, just like you see here, 96 of those for the year, not a month, the year, you've just created a $422,000 income for yourself, or a $35,000 a month income. Now that's a significant way to build your business. That is how you change the landscape of your client's life and your family's life. Now the problem is, how do we actually sell it? I'm glad you guys asked. Here's how we sell it, guys. We created a one-page fact-finding program for you that's really simple to do. You simply gather the client's information first, right here. You put their date of birth, the spouse, all that information here, and the children, and the address, and any pre-existing conditions. You put it in here. The next thing you want to do, you want to go ahead and let's determine what current plan they have. If they have a plan, it could be Blue Cross, it could be Aetna. You stick it right here. You put the plan option, whether it's a plan S, you put it right there, and then you put what their current monthly income is right here. The next thing you want to ask the client is, what is their desired monthly income? In other words, Mr. Client, you were paying $1,900 for the Blue Cross. If I could change that premium for you and I was authorized to do that, what would your desired monthly premium be? He's going to give you his budget. You put that right there. Then you make your plan selections. You add your MEC, whatever it is, whether it's an individual or a family. Then you select whether you're using the deductible plan or the non-deductible health choice select option. You put that here. Then you choose the other ancillary items, whether we're going with the accident, the critical illness, the prescription drugs, the disability, the dental. You include all that in here. Then you find that when you give your total, you put what the total is, the new proposed premium is here. You subtract that from what they were paying, and you got the monthly savings. You put it right here. The client gets to see their money on one sheet of paper. It's all itemized here, and you pick the client first of the month for the draft or the 15th of the month for the draft. It's just that simple, guys. Now, we're going to show you a very unique, exclusive, AHO only quoting system that allows you to quote everything you've just seen here, inclusive of our AHO Flex Life product. This is what's going to change the landscape because it allows the client to get to see in your proposal their ability to get their cash back right away. And we're going to show that feature with our RVP out of Michigan, Richard Spalter, is going to show that to you right now. And we're going to go ahead and get that up and going for you here. Let me switch over to Richard so that he can get to show it to you. And we will get that done right now. Richard, are you there?
Yes, I'm here, Clive. Okay, so we're going to start out by showing you the AHO Agent Center, which will allow you to create a beautiful presentation for your clients, both in the individual and in the group quotes. So we are going to start out, we're going to go down here, we're going to click on New, and we're going to go into New Lead. So first we're going to create a lead, and let me put we're going to fill this out here. I'm going to put Tom Jones, whoops. Okay, and Tom's phone number. Okay, put his email address in here. Okay, now Tom's street. And his city. State is Michigan. And the zip code, we'll put in 48322. The county will automatically populate. Estimated household income. Tom is married and doesn't have any dependents. So we're going to go down to the bottom here in the household info. We're going to put in Tom's birth date, which is 5/1/1987. Social Security number. Okay. Tom is a non-smoker. And Tom, of course, is a male. And we're going to go down to Brenda, his wife. And put in Brenda's birth date, which is 6/1/1987. Okay, and we're going to put in Brenda's social security number. And Brenda's also a non-smoker. We'll put Brenda down as a female, spouse, whoops, female, spouse. Okay, so now we have all that information. We're going to click on Save Lead. And a box will pop up, there it is, that will ask if you want to do a quote now. So we're going to click on yes. So there in the presentation, there's 3 different columns. So in the first one, we're going to do a marketplace plan. So I'm going to click off some of these just to make it easy. And whatever zip code you're in, it'll pull up the marketplace plans in that zip code. And we're going to click off, we're going to do a silver plan. Okay. So we're going to do the Blue Cross Premier PPO Silver as a premium of $998, and we're going to go down here to add to proposal, and we'll click on option 1. That'll put that in the first column. We're going to go back up to the top, and we're going to, for the second and third column, we're going to do AHO plans. So option 2, we're going to do Health Choice Select. We're going to add in accident, critical illness, prescription, and the WellMec. Okay, now we're going to pick the benefits under each of those categories. So annual maximum $1 million, silver plan, 50% first day hospital benefit. For accident, we're going to do 2 units. For critical illness, we're going to do 50,000. RX insurance, we're going to do generic only, and we are going to include the WellMec. And as you can see here in green, it has the broken down price of each part of the stack. And we're going to go to number 2. We're going to do Health Choice Select, accident, critical illness. We're going to do WellMec. So we'll go into Health Choice Select, and this one we'll do $1 million, silver, and 20%. The next one we'll do accident 2 units. Critical illness, we'll do 20,000. And we will also include the WellMec in this one. Okay, so we have all that there. The next thing you do, we're going to go to the AHO Flex Life. And we're going to add that into option 2 and 3. So what you do is you pick out what the monthly outlay is going to be. We're going to do $50. And we are going to also include critical illness in there. So as you can see, at the top it says cash at 65. That's an estimated cash value of your account, $193,967 at this point at age 65 for this person. Or you have a choice of taking monthly income for 30 years. So it would be $2,182 a month for 30 years. And at the end of 30 years, you will have gotten $785,567 back. The life benefit included is $37,793, and the additional critical illness on top of the critical illness we added in the beginning is $18,896. Now we're going to do the same thing for the second one. We're going to do $50, and we're going to include the critical illness. Okay, now we click on it, go up to the back on the top here, click on proposal, and this is just the rough draft. Everything looks good. Now we go to actions up in the right corner. We click on actions, and we're going to go to generate PDF. And here comes our PDF. So as you can see on the PDF, looks really good, and it's gonna break down the categories that you see on the left for every single plan that you have, the 3 plans you have on there, and you can compare all the benefits, and you'll be able to show why the AHO is the best choice for your client. Okay, next we're going to go and we're going to do a group quote. So what you do is you go back to the new category, you click on group quote. First thing we're going to do is put the name in there, and we're going to put Tom's Tavern. Oops, you know what? We're going to pick that. Hold on 1 second. Okay, we're going to do Tom's Tavern, and we are going to just redo these. Okay. Okay, so we're going to put the state in, which is Michigan, and then we're going to put the zip code, we're going to upload the census. So we're going to click on Upload Census, and we're going to put in the census for ABC Corporation, which we prepared before. And we're going to put in the contact, which is going to be Tom Jones. We're going to put in a contact phone number. Okay, and last but not least, we're going to put Tom's email address in there. Okay, so now we're going to save the group. And then we're going to go over here to pick the benefits that we're choosing. So we're going to click on the AHO tab. I'm going to click on Health Choice Select, Accident, Critical Illness, Prescriptions, and WellMec. And then we're going to slide down here and pick the actual benefits. So for Health Choice Select, we're going to pick $1 million silver 50%. We're going to pick 2 units of accident. Going to pick 50,000 of critical illness, and we're going to pick the brand wrap 1 and then the WellMec. We're going to include that. Second one, we're going to pick Health Choice Select, Accident, Critical Illness, and WellMec. So we're going to go Health Choice Select, million, silver, 20% on this one. Accident, we're going to pick 2 units just like the other one. Critical illness, we're going to do 20,000, and that'll be the second plan. Now what we're going to do is we are going to click over here, and we're going to just see the rough proposal, and everything looks good there. And we're going to click on Actions. First thing we'll do is go to Rates. We're going to generate a PDF of the rates. And that's coming up down here at the bottom. Okay, so we are going to look at the rates first. Okay, so this shows you the rates, and it's nice because it shows you the person, their age, gender, and then it breaks down the different parts of the stack, and then has how much each one's cost, and then it has the total premium all the way on the right. And it gives you a nice presentation for your group. So that's the rates. And you can see we did 2. You have option 1, and on the top here, in the bottom top you have option 1, and the bottom you have option 2. Okay. Next thing we're going to do is go back over here, and we are going to create we're going to generate a proposal. There's the proposal with all the benefits to show your client. So you have the proposal that shows the benefits for each option, and the first sheet we saw, presentation sheet, showed the breakdown of all the plans. So as you can see, you can really create a beautiful proposal using the software, and both on the individual and the group side.
Wow. Richard, thank you so much for breaking this down so everybody can see exactly how this quoting system actually works. This is how you sell it, guys. I mean, it's just that simple. I cannot tell you how happy we are to be able to offer this to you guys at this particular point in time. We're going to switch this back over. And Mr. Bowles, are you still there?
Man, wow, Richard, phenomenal job, guys. Phenomenal job. As I promised, this indeed was some very valuable information. Thank you, Clyde. Thank you, Richard, for this fantastic training. Again, this was brought to you by AHO Radio, the agent services and training platform for America's health options insurance plans. Stay tuned, gang, for the future airing. God bless you. Have a great day.